In all organizations, there is always this tendency to over-focus on the challenges of today. But I think organizations that are enduring, that will last over time, we always need to create the capacity to think about tomorrow. The culture of an organization must be able to embody always being able to look ahead. You've got to have a forward-looking DNA in order to be an enduring organization.
Throughout the pandemic, organizations and agencies have been supporting whole-of-government efforts to tackle COVID-19.
So for many years, we've been working on trying to enable SAF to have on-site diagnostic capability. So we have actually worked on trying to improve the pathogen detection and surveillance capability for SAF by developing portable technologies. This is how we started working on direct PCR assays.
In the first half of 2021, COVID-19 infections slowed down drastically. Long periods would pass without a single community infection. The worst of the pandemic was over. Or so we thought.
We are particularly concerned about the cluster linked to the Tan Tock Seng Hospital.
The world's best airport has become the hub of Singapore's largest COVID-19 cluster today.
182 hawker stalls at Bukit Merah View Market are closed for 3 days of cleaning after 2 COVID-19 cases in Bukit Merah are detected there.
Singapore's KTV COVID-19 cluster is growing.
For the Jurong Fishery Port cluster, it now stands at 169 cases, after 106 new cases were added to it today.
The nation was about to brace itself for yet another COVID marathon as cluster infections appeared one after another, spiking the charts once again.
One day, this global pandemic will subside, but I do not expect COVID-19 to disappear. It will remain with humankind and become endemic.
By September 2021, Singapore faced its largest local wave of infections with daily cases of more than 1,000. The situation called for a new strategy to ease hospitals of their bed space and manpower resources. In support of the Ministry of Health's Home Recovery Program, the Singapore Armed Forces deployed more than 450 personnel to support the Home Recovery Task Group.
The Home Recovery Program is now the default mode for recovery for individuals who are detected as COVID positive.
Personally, I understand the gravity of the situation. At the same time, we also do not want to see another circuit breaker if we do not make this work. To ensure that we are able to reach out and contact all our COVID positive patients who are on the Home Recovery Program, it is important that we have accurate data of their mobile numbers. So what we did was to organize a group of callers to try to reach them. We also send reminders, SMSs, to also assure them of our intent.
My role as a HR buddy is to serve as a first line of contact for COVID-positive individuals and onboard them for HRP. I also provide them with necessary information and assistance for their home recovery journey. Although it's challenging to manage difficult calls and over long hours, I'm proud to play my part in HRP as it helps to alleviate the strain in our healthcare system.
We have broken ourselves up into about 20 teams called the HVT or Home Vaccination Team, and each team will vaccinate between 6 and 8 households in a day. Different people have different reasons for not being able to go down to the vaccination centre, and there are a lot of people who are actually really homebound and bedbound and not able to go down, so it's in a way really helping them and helping to boost the vaccination rate in Singapore.
The training that we've done so far from the start of our NS Men life okay, do some refresher courses so that we are more prepared, more aware on what to do, what not to do, in order to have a positive experience for the patients that we attend to.
It's fulfilling. It's something we haven't really done before. It's interesting because no matter what we planned, new things always happen on the go. It's a very dynamic situation.
Subsequently, the SAF deployed 70 of its medical, nursing and administrative personnel to help out at 2 COVID-19 treatment facilities.
So we actually went in 30 men strong to augment CTF, basically to work as a junior nurse, so that they can relieve some of the nurses to NCID and back to the acute ward.
We usually take the patients who are in need of physiotherapy. We bring them to an activity corner where we engage the patients through simple motor exercises like climbing upstairs, going downstairs, walking around the ward itself. It's a very rewarding experience because of the fact that there are many things that I've picked up on in the experience itself, and I think it's one of the more unique experiences that cannot be really gotten anywhere else.
Through the second half of 2021, the situation remained tense as hospital manpower was strained due to the surge of cases linked to the Omicron variant. In support of the MOH, the SAF quickly responded and deployed medical personnel to augment the accident and emergency departments in Singapore's hospitals.
As part of the planning team, we actually had to liaise together with the Ng Hock Soon's operations team and make sure everything was in place before the NS men were actually deployed to the site itself. So this involved a lot of hours of work behind the scenes and liaising with them to ensure that we actually worked out the locations where they will deploy and what job scopes the NS men will have.
There's a lot of adjustments that have to be done. So basically, when we started working in the hospital, we have to do shift hours. That means we have to do either morning, afternoon, or even night shift itself, 24/7, on your feet, waiting to help the next patient that comes in.
The environment in the hospital is very different from what we encounter in the SAF on a daily basis. The medics were able to assist with the nurses in helping the patients, include taking their vital signs, meaning their blood pressure, their heart rate, and also their temperature. This reduced the waiting time for the patients.
Across the globe, many nations were still battling to keep their healthcare system stable. In support of efforts to battle COVID-19 overseas, the SAF extended a helping hand to neighbouring countries, including India and Indonesia. This mutual support reflects the close ties Singapore has with its neighbours, not just between governments, but also at a people-to-people level, standing together to tackle the challenges of the pandemic.
I planned the loading templates for over 60 pallets of respiratory equipment and 2 oxygen tanks. Most of the respiratory equipment came in small boxes, so in order to maximize the space that the warship has, we have to place it in pallets and secure it with string wraps. No ship has actually done it before, so there was pretty much nothing for us to be preempt. We have to plan everything from scratch, and there were many things that we don't know at that point of time. But everyone came together and took ownership on their parts of the ship to make everything happen.
Despite the challenges brought on by COVID-19, the SAF maintained a high degree of operational readiness and continued fourth-generation activities to ensure its core mission of safeguarding Singapore's sovereignty is not compromised. Weathering the storm, we have shown not only our unity of purpose and mission-mindedness, but also our determination to protect those we love and support the community we live in. May what we do today go on to inspire us tomorrow as we tackle all that may come our way.